Don't miss these 8 early prostate cancer signs. It could save your life. Health Aura. Know it right. Live it light. What if the warning signs of a silent killer were already showing and you just didn't recognize them? Imagine waking up one day and realizing that something preventable had been quietly growing inside you for years. Prostate cancer doesn't knock loudly, it whispers. And those whispers are often dismissed as aging stress or just normal. But what if recognizing just a few subtle symptoms could actually save your life? Over 34,000 men will die from prostate cancer this year, yet when caught early, the survival rate is a remarkable 98%. The danger lies in delay, not disease. Don't let assumptions like "I'm too young" or "I feel fine" cost you everything. In the next few moments, we'll reveal 8 critical symptoms that every man must know, regardless of age or health. This isn't just about awareness, it's about action. Ready to learn what could save a life? 1. Silent signals. What your nighttime bathroom trips might be telling you. You might think that your frequent trips to the bathroom are just a minor inconvenience, something that comes with age, or a result of drinking too much water late at night. But what if those nightly wake-up calls were more than just annoying interruptions? What if they were your body's subtle cry for help, warning you of a deeper issue that demands attention? Frequent urination, particularly nocturia, waking up 1 or more times at night to urinate, can be an early sign of underlying prostate problems. While it's easy to brush this off as a normal part of aging or stress, especially when you're otherwise feeling healthy, persistent nighttime urination should not be ignored. On average, most adults urinate every 3 to 4 hours during the day and can sleep 6 to 8 hours uninterrupted. If you're getting up more than once or twice every night, or noticing a sudden change in your daytime patterns, your prostate could be trying to tell you something. The prostate gland surrounds the urethra, and when it begins to enlarge, either from benign prostatic hyperplasia, BPH, or potentially something more serious like cancer, it can press against the urinary tract and interfere with normal bladder function. This pressure can lead to incomplete emptying of the bladder, causing you to urinate more frequently, even just an hour or two after your last visit. Nocturia in particular does more than just steal your sleep. It chips away at your energy levels, mood, and even cognitive clarity. Chronic sleep disruption can lead to fatigue, irritability, and difficulty focusing during the day. And while it may seem harmless or manageable, dismissing this recurring symptom could mean missing the opportunity to detect prostate cancer while it's still in its most treatable stage. Of course, it's true that other conditions like diabetes, heart disease, or the side effects of certain medications can also affect urinary habits. But here's the critical difference: prostate-related changes often build slowly, silently, and progressively. That's why vigilance is key. Begin by tracking your urination patterns. Are you waking up at night more often than before? Are you making more daytime trips to the restroom than usual? Does the urgency feel different, stronger, or more sudden? These aren't just quirks of your body. They are data points, and they matter. So don't wait until these signals become impossible to ignore. Early action can change outcomes. And if you're ready to take this seriously, drop a quick comment below that says "I'll stay alert." Let that be your first step toward protecting your prostate health, because awareness without action is never enough. 2. The hidden signal. What painful ejaculation may reveal about your prostate health. What if one of the most overlooked signs of prostate trouble wasn't visible in a blood test and X-ray, or even during your daily routine, but instead showed up in the most intimate moments of your life? Painful ejaculation is not just a fleeting discomfort. It can be your body's urgent whisper that something deeper is unfolding, something that demands your attention before it turns into a shout. Many men suffer in silence, brushing it off as stress fatigue or just one of those random things that happen with age. But the truth is, this kind of pain can be a red flag, a subtle but serious signal that your prostate is under distress. Whether it feels like a sharp jolt, a burning sensation, or a deep ache in your testes rectum or lower abdomen, these are not just isolated discomforts. They are messages from within urging you to pay attention. Under normal conditions, ejaculation should not cause pain. So when it does, it suggests that something isn't functioning the way it should. Conditions such as prostatitis, inflammation of the prostate, benign prostatic hyperplasia, BPH, or even early-stage prostate cancer can all manifest through this symptom. The mechanism behind it, an inflamed or enlarged prostate, can put pressure on surrounding nerves and tissues, interfere with the flow of semen, or disrupt the gland's natural function, each of which can translate into pain. This discomfort might seem manageable now, but what it represents could evolve into something far more serious. Think of it as a warning light on your dashboard. Ignoring it could mean missing your opportunity for early intervention. And when it comes to prostate cancer, early detection is everything. With early treatment, the survival rate is over 98%. But the longer it goes undetected, the more the odds change. You might think this is a problem only older men need to worry about, but that's a dangerous myth. Painful ejaculation can affect men of all ages, especially those with risk factors like a family history of prostate disease, poor diet, sedentary lifestyle, obesity, or prolonged exposure to environmental toxins. Even stress, which drives chronic inflammation, can silently influence your prostate's health. So what should you do if you've experienced pain during or after ejaculation? Even just once, it's not something to ignore. Make an appointment with your healthcare provider. A physical exam, a PSA test, and possibly imaging could be the gateway to understanding what's really happening inside your body. And if something is wrong, early treatment could save you from years of unnecessary suffering or even save your life. Don't let hesitation silence your instincts. This pain may be your body's way of protecting you, guiding you to act before it's too late. Take a stand for your health. Talk to your doctor. Track the symptoms. Share your experience. And if you're watching this because you're ready to take control, comment below, "I'm watching closely." Because awareness leads to action, and action saves lives. Let's break the silence and protect the health of every man brave enough to listen to what his body is telling him. 3. The silent warning. What blood in urine or semen may be trying to tell you. Have you ever noticed a drop of red in your urine or semen and brushed it off as nothing? Just a momentary glitch in an otherwise normal day. What if that small streak wasn't something minor, but your body's quiet cry for help? A signal that something deeper and more serious is unfolding beneath the surface. Because when blood shows up where it doesn't belong, especially in such intimate, protected parts of the body, it's never random. It's a message sometimes subtle, sometimes alarming, that must not be ignored. Blood in your urine, hematuria, or semen hematospermia doesn't always come with pain, and that's what makes it so dangerously deceptive. It might appear just once and never again. It might be faint, even microscopic, detectable only through a routine test. But whether it's visible or not, this warning can be your first and only chance to detect a silent growing threat: prostate cancer. The prostate, a walnut-sized gland, sits near a dense network of delicate blood vessels. When a tumor begins to grow within it, it can press on these vessels, tearing them ever so slightly and allowing blood to leak into the urinary or reproductive tract. It's not the dramatic gush you might expect. It's often a whisper, not a scream. But that whisper speaks volumes if you're willing to listen. Still, cancer isn't the only possible cause. Infections like urinary tract infections, UTIs, sexually transmitted infections, STIs, or prostate inflammation, prostatitis, can also trigger bleeding. These conditions, though sometimes less severe, still require immediate care. Because here's the truth: even if the cause isn't life-threatening, the symptom is always meaningful. Blood should never be in your urine or semen, and dismissing it as probably nothing is a gamble you cannot afford. The real power lies in your response. If you see blood, even once, take action. A visit to your doctor may include urine analysis, semen evaluation, PSA blood tests, and possibly imaging like ultrasound or MRI to investigate the prostate more closely. These steps are not just routine, they are protective. They are your tools to detect something early while it's still manageable. Because when prostate cancer is caught at an early stage, the 5-year survival rate is nearly 98%. That's not a statistic to ignore. That's a lifeline. So don't wait. Don't wonder. Don't assume it will go away on its own. Trust your body's instincts. If you've seen blood where it shouldn't be, your body is speaking to you. Listen. Investigate. Act. And if you're someone who's ready to take your health seriously, who's paying attention to even the faintest signs, comment, "I'm paying attention," below. Because awareness isn't paranoia, it's power. 4. When sitting hurts, a hidden signal: your prostate may be in trouble. Have you ever noticed that something as simple as sitting, something we all do countless times a day, suddenly becomes uncomfortable? Maybe it's just a dull pressure in your lower back. Maybe it's a strange sensation deep in your hips. Or maybe over time it has grown into a sharp, persistent pain that makes every seated moment a reminder that something isn't quite right. You might dismiss it as a muscle strain, a hard chair, or aging bones. But what if it's not? What if that pain is your body's subtle way of crying out for help? Here's the truth. Most men don't realize pain while sitting can be one of the earliest red flags of prostate dysfunction. It's not loud, it's not dramatic, but it's there. A whisper of pressure in your pelvis, an ache that deepens with time, a sensation that you can't quite name until you can no longer ignore it. This isn't just about comfort. This is about catching something potentially dangerous before it becomes unmanageable. The prostate, a small gland nestled deep within the male pelvis, plays a silent but critical role in the body. Yet when it begins to swell, whether from benign prostatic hyperplasia (BPH) or something more sinister like prostate adenocarcinoma, it doesn't stay silent for long. That growth creates pressure, and that pressure translates into pain. Not just any pain that can radiate into your lower back, your hips, even your thighs. Pain that transforms every chair into a challenge. Pain that lingers after you stand and shadows you as you walk. But here's the most dangerous part. Many men ignore it. They wait. They tolerate. They adapt. All while a potential storm brews beneath the surface. You don't need to panic, but you do need to pay attention. Pain while sitting isn't always a pulled muscle or poor posture. It could be your body's way of alerting you to an enlarging prostate pressing on nearby nerves, or worse, a tumor interfering with the structures that support your mobility. And unlike typical muscle pain, this discomfort doesn't ease with stretching or massage. It stays, it returns, it disrupts. So if you've started to notice changes in how you feel when you sit, especially if that pain is located in the pelvic region, back, or hips, don't wait. Prostate issues, including cancer, are treatable. In fact, when caught early, prostate cancer has a survival rate of over 98%. But early detection requires early recognition. And sometimes the body whispers before it screams. Keep reading, because what you're about to learn next could help you identify the full picture behind this symptom and empower you or someone you love to act before it's too late. 5. When back, hip, or chest pain means something more. Have you ever felt a nagging ache in your lower back, your hips, or even your chest, and just chalked it up to getting older, or maybe sleeping in the wrong position? Most of us do. We live in a world that teaches us to brush off discomfort, especially when it comes on slowly or seems manageable. But what if your body is actually sending out a more serious message? What if that pain isn't from a pulled muscle or a long day on your feet, but something much deeper? For men, particularly as they age, pain in these areas can sometimes be an early alarm bell for something more dangerous like prostate cancer that has silently begun to spread. Unlike typical soreness that fades with rest or a warm compress, the kind of pain caused by cancer spreading to the bones is different. It doesn't back down easily. It lingers, it sharpens, and it often shows up in the same regions: your spine, your hips, or your chest. This isn't about fear, it's about awareness. Because when prostate cancer leaves the gland and starts moving through the body, it often heads straight to the bones. The back and hips are common landing spots because they contain rich areas of bone marrow where cancer cells like to settle and grow. And when they do, the pain that follows isn't just annoying, it's relentless. That's why it's so important to pay close attention. Pain that doesn't go away, gets worse over time, or refuses to respond to standard painkillers isn't something to ignore. Your body knows when something isn't right, and it's your job to listen. 6. Persistent swelling in the legs or feet. It's easy to brush off swollen feet or legs as a harmless side effect of standing too long salty food or hot weather. But what if that swelling isn't temporary? What if it's your body's quiet cry for help? When the puffiness in your lower limbs refuses to subside or keeps returning, especially without a clear reason, it could be pointing to something far more serious: the progression of prostate cancer. This kind of swelling is not your average fluid retention. When prostate cancer spreads beyond the gland, it often targets the lymphatic system, a critical part of your body's immune and waste removal network. The lymph nodes located in the pelvic and groin areas act like filters for excess fluid and harmful particles. But when cancerous cells invade these nodes, they block the normal flow of lymphatic fluid. With no clear exit, fluid begins to pool in the lower extremities, resulting in visible swelling known as lymphedema. But this isn't just a plumbing issue. The inflammation triggered by your body's response to the cancer also contributes to the swelling. It's the immune system's attempt to fight off the invasion, but instead, it creates additional pressure and discomfort in your legs and feet. The affected limbs may feel heavy tight or even tender to the touch. And unlike normal swelling, this doesn't go away with a night of rest or by putting your feet up. Swelling linked to prostate cancer tends to be more stubborn and persistent, and it's often a red flag that the disease is no longer localized. It could be accompanied by other unsettling signs, frequent nighttime urination pain during ejaculation, or lingering back discomfort. When multiple symptoms begin to converge, the puzzle becomes clearer. The cancer may be advancing, and the lymphatic system is under siege. So what should you do if you notice unexplained swelling in your legs or feet that doesn't respond to typical remedies? Don't wait for it to worsen. Get it checked. Imaging tests or lymph node biopsies can help determine whether prostate cancer has spread to your lymphatic system. The earlier you catch it, the better your chances of managing it before more damage is done. Have you ever looked down and noticed your ankles puffed up for no reason? If so, share your experience by commenting, "I'm noticing the signs." Your voice could alert someone else to this critical symptom. When it comes to prostate cancer, awareness is more than powerful. It's life-saving. 7. When the pounds disappear. Without a reason, have you been shedding pounds without trying, without hitting the gym harder or changing your meals? If so, don't just shrug it off. Unintentional weight loss isn't just a random event. It's often your body waving a red flag that something isn't right. And when it comes to advanced prostate cancer, this subtle change can be one of the most revealing yet easily ignored symptoms. Unlike planned weight loss that comes from effort and discipline, this kind of weight loss feels like it's happening to you not because of you. That's because when prostate cancer progresses, it hijacks your body's metabolism. The tumor cells behave like greedy invaders, pulling energy, protein, and calories away from your healthy cells to fuel their own aggressive growth. Even if you're eating as usual, your body can't hold on to those nutrients. Muscles begin to shrink, fat reserves vanish, and the number on the scale keeps dropping. This isn't just a cosmetic shift, it's a metabolic breakdown. And along with that physical change often comes relentless fatigue. Not the kind that goes away with a good night's sleep, but a deep, dragging exhaustion that fogs your mind and weakens your every move. You may feel like you're running a marathon in your sleep. This happens because the body is not just burning calories, it's fighting a silent war inside, draining every reserve it has. If you're wondering how this process works, a condition known as cachexia is often behind it. It's a syndrome where cancer interrupts nutrient absorption and triggers severe muscle wasting. This is why even eating more doesn't stop the loss. It's not your fault, it's the disease shifting your body's inner gears. So if you or someone close to you is experiencing weight loss without a clear reason, especially when paired with other symptoms like back pain, fatigue, or urinary issues, it's time to act. Don't wait. Don't hope it goes away. Get it checked. Catching the cause early could make all the difference. 8. Silent paralysis. When prostate cancer reaches your spine. Imagine waking up one morning and your legs no longer feel like they belong to you. You try to stand, but they don't respond, not in the way you expect. There's a strange tingling creeping through your limbs, maybe a numbness that feels like your body is disconnecting from your mind. What if I told you this silent takeover of your nerves could be an overlooked sign of something far more dangerous than just a pinched nerve or poor circulation? When prostate cancer escapes its original territory and reaches your spine, it doesn't just grow, it disrupts everything. This advanced stage of cancer is no longer a localized threat. It becomes a predator of your nervous system. The spine, your body's communication highway, is suddenly under siege. A tumor pressing against the spinal cord can compress delicate nerve fibers, causing signals from your brain to misfire or go completely silent. The result? Numbness, tingling, weakness in your limbs, and in some cases, loss of control over your most basic functions. This isn't something that can wait for your next checkup. This is your body's emergency alarm. As the cancer advances along the spine, its effects can vary. You may begin to notice a gradual decline in your ability to perform tasks that once felt automatic. Holding a cup of coffee becomes challenging. Climbing stairs feels like lifting concrete blocks. Some men report a strange pins and needles sensation, while others describe it as though their legs are made of rubber. And when the nerves controlling your bladder or bowels are affected, it may lead to incontinence, a symptom that's as psychologically distressing as it is physically debilitating. These neurological effects aren't random. They are powerful indicators that cancer has breached the barrier of containment. This kind of spinal cord compression is a medical emergency. Left untreated, it can lead to irreversible nerve damage and permanent loss of mobility. But here's the hopeful truth. If caught early, there are treatments that can relieve the pressure, reduce tumor size, and in some cases restore lost function. The key is not to ignore the whispers your body is sending. So if you ever find yourself struggling to walk, feeling unusual, tingling in your arms or legs, or losing control over bladder and bowel movements, don't delay. Seek immediate medical attention. These aren't just annoying symptoms, they could be the body's last attempt to warn you before something worse happens. In the silent language of nerves, this is how your body cries out for help. And now that you know what to listen for, you can answer that call before it's too late. Understanding the risk factors for prostate cancer isn't just about collecting information. It's about giving yourself a real advantage in protecting your health. The truth is, prostate cancer doesn't always give obvious warning signs early on. That's why knowing your personal risk is one of the smartest moves you can make today. Let's break it down. Age. If you're over 50, your risk rises sharply. Prostate cancer is far more common in men past this age, so regular checkups and proactive health monitoring are crucial. Race Black men are at a significantly higher risk, not just of getting prostate cancer, but of being diagnosed at a more aggressive stage. While the reasons aren't fully understood, this makes early vigilance even more critical. Family history. Has someone in your family, father, brother, or even someone with BRCA1 or BRCA2 gene mutations been diagnosed with prostate or breast cancer? If yes, your risk is elevated. Genetics matter, and knowing this gives you the power to act early. Obesity. Carrying excess weight isn't just a general health concern. It may be linked to a more aggressive and difficult-to-treat form of prostate cancer. Maintaining a healthy weight isn't just about appearance, it's about survival. Now take a moment. Have you ever noticed subtle changes in your body, like numbness or weakness in your limbs? Do you wake up more frequently at night to urinate? These aren't just annoyances. They could be silent signals from your body that deserve attention. Drop a comment below if any of these risk factors apply to you, or if you're committing right now to stay vigilant about your prostate health. Open the conversation. It could help someone else recognize their own risk. If this information made you think twice, it's time to act. Tap the like button to support awareness. Hit subscribe so you don't miss out on powerful life-saving health insights. And explore the videos on screen. We've got more crucial tips waiting for you. Your health deserves your attention. Don't wait.